Hello and welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for September 17th, 2025. Thank you for joining us today, and thank you to the current Osteoarthritis Action Alliance sponsors shown here who help support our work, which includes the monthly Lunch and Learn series. Now it is my pleasure to introduce today's speakers, Maja Mazur and Qiling Chen. Maja has been involved in leading highly disruptive technology projects in regulated sectors since 2019, most notably as a technologist and a former solicitor qualified in England and Wales. She played a key role in launching the first LawtechUK Sandbox, funded by the Ministry of Justice in England, which supported a number of pioneering legal tech projects in England. Inspired by her own journey with chronic hip pain, she is now the CEO of Healthnix, a smart food as medicine company focused on helping those who suffer from chronic pain through personalized nutrition and whole person care programs. In her role, she is responsible for the strategic direction of the company, leads Healthnix academic and clinical partnerships, and provides product leadership oversight. Dr. Qiling Chen earned her master's and PhD degrees from Imperial College London, where she focused on gut microbiota and metabolomics studies related to human diseases. Her interests span gut microbiota, omics studies, and precision medicine. At Healthnix, she leads science and research strategy, development of Healthnix research protocols, internal scientific evaluations of the Healthnix Food Scoring Engine, and is one of the co-authors of the recent study completed with Imperial College London on nutrition as a self-management tool for osteoarthritis. The title of today's presentation is Food as Medicine for Osteoarthritis: Practical Tips, Research Spotlights, and What the Future Holds. Welcome, Maja and Qiling.
Thank you so much for the introduction, Kirsten. It's a big privilege to be here, and we are very excited to be able to share with everyone the latest research spotlights and why we are so optimistic about the future. So before we start with the optimistic part, I would like to kick us off by really acknowledging the importance and the urgency of the current chronic pain and chronic disease crisis in the United States. We are currently facing a situation in which 1 in 4 American adults suffers from chronic pain. We know that arthritis is the second highest expense for our employers. And unfortunately, we know that we only have one pain specialist for over 28,000 patients, which translates to access challenges. At the same time, we know that food as medicine is already transforming diabetes, oncology, and GI care. And the reason why we are so excited about today's webinar is because we really want to make a strong case for food as medicine in osteoarthritis pathways, as well by sharing more of the evidence available for why it's important to do so. Now, before moving on, a very quick disclosure. Kirsten has already very kindly introduced us. We are representing Healthnix, which is a smart nutrition software specifically for chronic disease and pain management. What we've built helps dietitians work with patients in a more dynamic, more accurate way. It's specifically tailored to chronic pain population and really focused on behavioral skills coaching in addition to food as medicine. But today's event is very much focused on the research spotlights and sharing some practical tips for everyone listening. So without further ado, Dr. Chen, could you please talk to us a little bit about the scientific evidence out there that nutrition can help with OA symptom management?
Yes, we do have a lot of scientific evidence for nutrition in osteoarthritis management. At Healthnix, we have reviewed studies covering almost 1 million participants from 13 countries and 5 continents. Here are the 3 examples. In the first example, 18 months of diet and exercise reduced the WOMAC pain score by 30%. In the second example, 12 weeks of Mediterranean diet improved the standing arthritis knee pain by 100%. In the third example, 2 months of anti-inflammatory diet improved the WOMAC pain by 44%. So the evidence for nutrition in osteoarthritis management is very strong.
Thank you. So is the question that I think often comes up is we have different diets in different patient populations, but is it only about weight loss, or is there something more to nutrition in osteoarthritis management?
Of course, there is more. Follow-ups to the first studies I mentioned before show that underlying mechanisms go far beyond the weight loss. In the first example, 18 months of diet and exercise reduced WOMAC pain score by 30% and WOMAC function score by 24%. Interestingly, a follow-up causal mediation analysis suggested that the change of weight measured by the change of BMI actually played a small role in these improvements. The change of BMI contributed 0% to WOMAC pain, whereas the changes of inflammatory biomarkers drove 15% of this WOMAC pain improvement. For WOMAC function score, the change of BMI drove only 4% of the improvement, whereas the changes of the inflammatory biomarkers drove 29% of the improvement. In the second example, 12 weeks of Mediterranean diet improved standing knee pain by 100%, and the observed reduction of the WOMAC pain score was more than twice greater in Mediterranean diet group than in the low-fat diet group. However, the weight loss was similar between the Mediterranean diet group and the low-fat diet group. Despite of both groups are following the exactly same calorie control program. This shows that it is the components in the Mediterranean diet that were behind the pain improvement rather than weight loss. In fact, I think it's next slide. In fact, chronic low-grade inflammation is key in OA development. Chronic low-grade inflammation is defined as a low-level immune response to harmful stimuli, which lasts up to months or years. A number of factors are known to increase the risks of OA. These include injury, aging, gender, gut microbiome, obesity, and metabolic disorders. The factors that can be influenced by the diet, gut microbiome, obesity, and metabolic disorders among all these risk factors. And all these risk factors are connected with chronic low-grade inflammation through different mechanisms. So the question is, how does chronic low-grade inflammation contribute to the OA development? Well, systemic chronic low-grade inflammation can set up a cycle of joint damage. This can disrupt the normal biochemical signals in the joint, impair the metabolic activity of the chondrocyte and macrophages, increase the activity of the enzymes that can break down the cartilage, leading to the degeneration of the cartilage. Hence, diet and nutrition can modulate OA symptoms through different mechanisms, with chronic low-grade inflammation as a key part. As research shows, the weight loss only plays a very small part of this modulation.
Thank you. And thinking about what that actually means in practice for those living with OA or those working with patients with OA, if we are seeing such positive evidence for the effectiveness of nutrition, why is it not more commonplace? What are some of the most common barriers to using nutrition as a self-management tool?
To answer this question, Healthnix collaborated with Professor Austin L. Osta from Imperial College London to investigate the role of nutrition and self-monitoring in osteoarthritis through a survey of 1,104 adults from the United Kingdom. Among 359 participants with osteoarthritis, the three most common barriers to use nutrition as a self-management tool were first, uncertainty of the food. 78.5% of the participants were not sure what the right diet was for them. Second is cost concerns. 60.2% of the participants said that cost living make it difficult for them to change their dietary habit. The third one is time constraints. 47.6% of the participants claimed that they didn't have enough time to prepare meals and or buy the groceries.
Thank you. And could you also tell us a little bit more about what we learned about the value of tracking symptoms and food when living with osteoarthritis?
Yes, from our study, symptom trackers were 1.43 times more likely to know which dietary patterns make OA symptoms worse. Symptom trackers were 55% less likely to disagree about whether a diet was inflammatory or not, which means that they have a better understanding about whether a diet was inflammatory or not. 38% of the symptom trackers focused on their diet, which is very important and relevant during an OA flare-up, in comparison to approximately 16% of the non-trackers who focused on their diet during an OA flare-up. From a general perspective, tracking the symptoms can help the clinicians and the patients to identify the triggers and the patterns of their conditions. The clinicians can monitor the efficacy of their current treatments. The involvement of the patient can help the patients to become more active in managing their own symptoms. It can also help the patients to communicate with the clinicians or dietitians in a more accurate and efficient way. When tracking the food, dietitians can check the quality of the diet, identify the problematic and beneficial foods for the patients, and reinforce the beneficial foods for them. At the same time, patients can enjoy the good consequence of the good weight management. So the answer to the question is yes, we should follow. We should track the symptoms, and we should track the food we eat, and there is a research prove it, support it.
Thank you.
Next question is, what is me asking Maja? What are your practical tips for incorporating nutrition into one's self-care?
We like to split them really into four main pillars to simplify it and make it a little bit less overwhelming, because we know that nutrition can be very overwhelming. I'd say start by really acknowledging that it's better to not do it yourself. We highly recommend that you work with your physician or with a dietitian. Really focus on personalization, know both what your body needs and also what really works for you given your lifestyle. Really focus on small but lasting changes. Consistency always trumps big one-off interventions. And finally, remove the key offenders. And I'll talk a little bit more about each of those four pillars right now to explain what we mean. So first of all, a question we often get, and a very important one when it comes to practical considerations, is what is the difference between a dietitian and a nutritionist in the US? Now, every registered dietitian is a nutritionist, but not every nutritionist is a registered dietitian. What I mean by that is that in order to hold a title of RD, a person needs to complete an accredited educational program. They need to pass a national exam and complete a number of ongoing continuing education credits every year. They are subject to licensure in most states, and their scope of practice includes clinical work, research, and private practice. Now, for nutritionists, that is not the case. We do have nutritionists who have the same level of training as registered dietitians, and they simply decided to not pass the national exam. for whatever reason, cost being one of them. But we also have a lot of nutritionists who might have no formal education whatsoever, or who might have only completed very short online courses. So it's very important to always check the qualifications of the nutritionist that you are working with to make sure that they are well positioned to help you. Something that's also really important is regulation applicable to nutritionists is significantly less standardized than that applicable to registered dietitians. So keep that in mind when checking your insurance coverage and who you are getting your advice from. Now, secondly, the most important question, how are we really making the nutritional protocol yours? First of all, really think about what are your goals and be realistic about it. Nobody will be able to achieve all the goals at the same time. And it's very important when speaking to your physician or to your dietitian to get clarity on what is the most important to you at this point in time. Is it weight loss? Is it improvement in your pain symptoms? Is it, for instance, improving your energy levels, how you sleep, or anything else that might come into play? Then the next very important step is thinking about any other chronic conditions that might be relevant to you, medication that you're taking. Those really come into play and they influence what kind of nutritional protocol will be safe and will be most effective. And then, of course, budget, huge consideration, really thinking about what kind of access to food you have, what kind of budgetary constraints you're working within. It's very important to know that eating healthier doesn't mean eating only organic and fresh food. It means making smarter, healthier swaps within the budget that's available to you. And then finally, really think about the reality of your social life, your family, your nutrition. Yes, it is clinical. We really want it to be a part of your clinical care, but it is, first of all, very social and personal. So what works for you? What works for your kids, for your loved ones? Do you eat out? Do you even have time to cook? Thinking about how to adjust it to your day-to-day. And then, of course, testing for allergies and any various intolerances. That is something that your doctor or your dietitian will be able to advise you on and whether that is relevant to you. Now, I like to give an example of why personalization matters, because I think we often assume that it's way less complex than it actually is. So let's take an example of Maria, our 52-year-old female patient who happens to suffer from arthritis, IBS, hypertension, and diabetes. Now, a typical Mediterranean diet list might sound like a good framework to begin with, but you will quickly see that actually it becomes very restricted once we apply various filters to that. And when you look at that, accounting for her various other chronic conditions, as well as her personal likes and dislikes, we really end up with a very narrow list of recommended foods. And this is where working with a dietitian can really help you identify what changes will lead to the biggest impact and what really makes a difference and how to make it work within your day-to-day. Now, next one was minimizing your key offenders. Very big topic right now. We are seeing a lot of this in the media. Very important to understand that this is not about eliminating them completely. We know that everyone loves their comfort foods, and that's completely okay. But it is about making informed choices and really understanding what those foods mean to your health, and also what do we mean when we talk about ultra-processed foods. So for instance, in that category, you will find things like Nutella, but also bacon, certain hams, certain breakfast cereals. Really think about how can you minimize the number of times that you consume these foods in a week, because they do have a big negative health impact. Thinking about additives, we are seeing very positive developments when it comes to the requirements around transparency and asking various food companies to include warning labels when certain chemical additives are included in the foods. And then also really becoming more aware of various marketing strategies that we are seeing out there, which promote certain foods as healthy substitutes, when in fact they often end up being very highly processed and actually not that great for many patients. That includes various protein bars, meat substitutes, and certain other products marketed as very healthy when in fact they might raise some eyebrows.
So what does the future hold?
Well, we are actually very optimistic about it. Like I started hinting in the previous slide, talking about various additives and warning labels, we are seeing really positive momentum around insurance coverage for nutritional guidance. Please do check whether your current health plan covers it. It is very likely that it does. We are seeing also a momentum and, well, legislative push to make sure that everyone on Medicare will be eligible for nutritional guidance. We've already seen legislation passed, for instance, in Texas as part of the Senate Bill 25, requiring consumer goods packaging to include warning labels when certain additives are present in foods. Again, this is not about food police and forbidding these foods. It's about making sure that it's easy to know when you are purchasing them. Right now, it's incredibly hard to navigate nutrition labels. Kind of a rule of thumb is if it's very long and you can't pronounce it, then it's probably not great for you. But we need significantly more clarity, and the clarity should come from the companies really promoting these foods. So that is thankfully right now being translated into legislative requirements. And then finally, we are also seeing a big push to include lifestyle medicine in the standard of care across different conditions and across different clinical pathways. This is a very positive development, and we hope that given everything that is happening shortly, you will always receive lifestyle and nutrition guidelines from your primary care physician before anything else, if that's appropriate. And finally, just to wrap up, we are excited about the potential that AI presents for food as medicine. We do believe that one of the biggest challenges up until now was the sheer complexity of data. The way that I like to think about it is, in our opinion, clinical nutrition is at the same tipping point as human genome was a number of years ago, when we thought it was way too messy to map. And yet right now it is commonplace to do so. We believe that AI can help us overcome the shortage of doctors and dietitians, really amplify their impact, help with personalization on biological level, but also to those personal likes, dislikes, and needs. So that takes us to the Q&A part of the session. I would really love to leave everyone with, leaving parting thoughts that nutrition really matters. It's about starting small, keeping it practical, keeping it personalized, and really trying to not do it by yourself, but seeking help. If you have any questions, please feel free to email me. This is my email address and also QR code taking you straight to my inbox. Thank you.
Thank you so much for that presentation. We now have time for question and answers. If you have a question, please feel free to type it into the chat box and I will read it aloud. Also, we'll acknowledge that one of our participants has noted a study that is ongoing in the chat box. So check that out, learn more, and feel free to reach out to that person. While people are thinking about questions they might have, I will lead off with one that has come in ahead of time. For Maja specifically, if someone is on a budget or cooking for a family, What tips do you have for eating healthy in those cases? It can be challenging when you have not a lot of funds and a large number of people.
Yes, thank you, Kirsten. It's a very important question. And I think the most important starting point for answering it is acknowledging that eating healthy doesn't mean all fresh and all organic, because we know that's simply impossible for many of us. But what it does mean is thinking about your cooking methods. So for instance, there's a huge difference between a chicken that was deep fried and a chicken that was steamed or boiled. It's thinking about the swaps within your budget, which might be equally tasty. So again, for instance, some processed red meat or deep fried chicken being with pasta being swapped for beans and lentils with rice, let's say. Thinking about really understanding those nutritional labels. So many yogurts have a lot of added sugars or other, colorings, which are really not healthy and not great for us. And within the same price point, we can actually be purchasing very different quality dairy products. So it's becoming it's learning how to identify these hidden traps and how to make the swaps within your budget and not feeling that everything has to be perfect or incredibly organic.
Thank you. Good points to consider. Very helpful. I will look. There's a couple of questions in the chat. One, Austin asks, how quickly do we expect to see a change in symptoms after lifestyle medicine intervention, symptoms for osteoarthritis?
Yes, thank you, Austin. We are seeing actually a very varied indications across different research studies from 3 to 4 weeks improvement. That's, for instance, something we've seen with our own users or in certain papers. There's been a really interesting paper recently showing 30% WOMAC pain improvement after only a 4-week anti-inflammatory diet intervention, which I think is incredible. Realistically speaking, I would probably put it closer to 5 to 8 weeks. We know that change takes time. And to my earlier point, it's unusual to see the perfect change taking place straight away. But it is shockingly quick, I would say, when compared with physical therapy or other available self-care strategies.
Thank you. And this next question gets a little bit deeper into the weeds with regard to impact for OA. Evelyn writes, thank you for a lovely presentation. How does your company measure the pro-inflammatory cytokines? And is there a typical time frame for the shift toward anti-inflammatory markers?
Yes. So I think when it comes to the time frame, that links to my previous answer to Austin's question. We are looking at probably anywhere from 4 to 8 weeks. How do we measure it? We do look at a number of inflammatory markers in the commercial product. When it comes to the clinical research studies we are hoping to run in the US, we want to look at a wider range of markers. But I can definitely take that question up separately offline, because I think we don't have time to really get into the detail of it now.
Thank you so much. And speaking of that, I'm noticing that we are at the end of our time. I know that there are more questions in the chat. We will get those questions answered and sent out to folks afterwards, but I do want to acknowledge that we are at the time frame. And wanted to thank you again, Maja and Qiling, and thank you to everyone who attended today's presentation. In just a moment, we will launch a brief there it is. Thank you, Katie. A brief satisfaction poll for today's presentation. Please answer those questions as you're able before you hop off. And then finally, we've added the next presentation coming up on October 15th at 12 p.m. Eastern for a presentation titled Pain Scores in Osteoarthritis and Rheumatoid Arthritis Patients Unchanged Since 1979. The Implications for Care and Research, featuring our speaker, Theodore Pincus, So I hope you can join us for that. And like I said, we'll get those questions answered. And just wanted to thank you for joining us today and have a great rest of your day.
Thank you, everyone.